Welcome everybody. Thank you for joining us. We're here this morning to report on results from the 2019 Rhode Island Hunger Survey. I'm Andrew Schiff. I'm the CEO here at the Food Bank. The Hunger Survey was conducted for the Food Bank by the Hassenfeld Institute at Brown University. And we're very happy to have from the Institute Melissa Clark and Patrick Vivier. The Food Bank was very lucky to have a local academic partner that had the expertise to conduct the survey and interest in working with a community organization. And both Melissa Clark and Patrick Vivier are going to be available for questions after I say a few words. I want to start, here we go, by describing the major findings from the survey. The faces of hunger in Rhode Island and the people most vulnerable to the harmful effects of hunger are children and senior adults. Among households served at food pantries, 2/3 have at least one child under age 18 or a senior over age 65. One of the consequences of hunger is poor health. We know hunger is a health issue, but we were surprised to find that 45% of respondents have fair or poor health as compared to good, very good, or excellent health. 41% of households have a member with diabetes. 60% have a household member with hypertension. (88% of the household surveys had an income below the federal poverty level. And yet, 69% of households with children have an adult who is employed in the last year. Even though they're working, they're not earning enough to advance out of poverty. They're left with tough choices. Over 30% of households had to choose at some point in the last year between purchasing food or paying for another basic household expense, the rent, utilities, putting gas in the car, health care. Close to half reported borrowing money from a friend or family member. 75% of our households served by the Food Bank are enrolled in SNAP. The USDA is proposing major changes to SNAP that will reduce benefits and cut eligibility. If enacted, these changes will take SNAP benefits away from individual adults in Rhode Island and families with children, increasing the demand at food pantries and meal programs. So that's a summary of the major findings. With the help of the Hassenfeld Health Innovation Institute, we're able to train up volunteers and train staff members at the Food Bank to go out to meal programs and food pantries and interview people who are receiving food assistance. And we have about 200 food pantries and meal programs across the state that we're distributing food to. But our research experts helped us randomly select 61 places, and we were actually able to get out to all 61 and ask people to participate. And we asked 663 people to participate, and 2 out of every 3 people said that they would and sat with us for 20 minutes, basically shared, very, very detailed aspects of their lives. So all that means that we were able to have a representative sample of the people served by the Food Bank. So to put this all into some context, in September, the USDA reported that 11% of households in Rhode Island are food insecure. That means they cannot afford adequate food. Nearly half of those households that reported food insecurity reported the most severe conditions: skipping meals, not eating for an entire day, going hungry. We know that the Food Bank every month, through our statewide network of member agencies, is serving 53,000 people. So the purpose of the survey was to provide an up-to-date and comprehensive view of the people that we serve. and get a real good sense of their needs even beyond food assistance. We're concerned about every single person in Rhode Island who needs food assistance, but we're particularly concerned about children and seniors. Hunger has long-term consequences for children's health, learning, growth, and development. Hunger puts senior adults at risk for illness, cognitive decline, and loss of independent living skills. So as I mentioned, it certainly shows that we have reasons to be concerned about health. Households receiving food assistance clearly have compromised health. As I mentioned, 45% report poor or fair health. 41% have a household member with diabetes. To put that in context, the prevalence of diabetes, type 2 diabetes in the United States is 9%. Here we have 41% of households reporting a member with diabetes. 60% of folks in the sample said that they had a household member with hypertension. The prevalence in the United States is 30%, so this is double. Simply put, hunger takes a toll on people's health. The survey found also that the food bank serves some of the poorest households in Rhode Island. 88% had income below the federal poverty level. For an individual, that's annual income below $12,490. For a three-person household, that's annual income below $21,330. Imagine being a parent with two kids earning less than $2,000 a month and having to find a two-bedroom apartment for your family, afford all the bills, and also be able to pay for food. It's not possible. And then, many of the parents that we interviewed were working. 69% of households with children have an employed household member. Of all households surveyed, 44% had a household member working for pay in the last year. Now, so we asked folks who were unemployed and not working, how come they weren't working? 23% were retired, so this is the older population that we serve, but 63% stated that they were not working due to poor health or disability. Through the survey, we tried to find out and ask, how do these households cope? How do they manage? We asked people about the difficult decisions that they make, what we call trade-offs. For households with children, 51% had to choose between paying the utility bill or buying food at some point in the last year. 46% had to choose between paying the rent and buying food. 39% had to choose between paying for transportation or food. Many resorted to borrowing money. Almost half had to borrow money from a friend or family member. 33% carried debt on a credit card or loan. 30% had unpaid medical bills. The survey is showing us a picture of individuals and families that are squeezed between the high cost of living in Rhode Island and limited income and resources. One of their biggest expenses is rent. So just 9% of the people we surveyed were homeless or in temporary housing. Homelessness is a very serious problem in Rhode Island, but the vast majority of people served by the food bank have permanent shelter, what we call permanent shelter. Most live in an apartment and pay rent. So it's permanent, technically, but it's not always stable housing. 10% of those surveyed reported eviction or foreclosure at some point in the last 5 years, the most disruptive events for any household. We know that food pantries and meal programs are just one source of food for people to serve. Government nutrition programs like SNAP, WIC, and school meals are important sources of meals too. 75% of the households that we talked to were enrolled in SNAP, and that's a good thing. In the past, many eligible households were not enrolled, and that's really improved, as you can see here, over the years. But the SNAP households told us that their benefits were not adequate. Most use up their benefits within 2 weeks and then turn to food pantries to feed their families. Low-income households need higher SNAP benefits, but the USDA is proposing just the opposite. They're proposing to cut SNAP. Under one proposal, 11,000 Rhode Islanders would lose their benefits entirely, including 5,000 children. This is despite the fact that Congress approved the Farm Bill last year, in which they secured SNAP benefits at current levels with bipartisan support. Finally, the survey asked about citizenship. Oh, you can see, almost everybody surveyed was a U.S. citizen or permanent legal resident. Now, we're actually concerned about this because we know that people who are in the process of applying for a green card are avoiding government services and are afraid that that will affect their road to citizenship. What we're concerned about is it's also leading people to not seek our help at food pantries and meal programs. And I think we're going to have to do a lot more working with other organizations that work closely with immigrant families to improve on that. So the results from the survey provide a portrait of the people served by the food bank. Their children, seniors, and the working poor. They live in poverty, face hardships, and make difficult financial choices, and they suffer from poor health. Many are enrolled in SNAP, but they also rely on food pantries and meal programs because SNAP benefits alone are not adequate.